How can I be sure to protect myself from a heart attack? When does the risk of this dangerous disease increase? Is it possible to help your heart without taking harmful drugs? About this in our video. When should you fear a heart attack? A heart attack is the leading medical cause of death. Contrary to the opinion that a heart attack is dangerous in old age, this stroke can also hit young people. The causes are in the malfunctioning of the cardiovascular system. The key one is atherosclerosis of the blood vessels. Also, problems with the heart muscle can lead to a heart attack. If it becomes weak and unable to pump blood in sufficient amounts, it also increases the risk of heart attack. In all cases, a persistent increase in blood pressure accompanies the development of heart disease. And if you're having trouble maintaining normal blood pressure, it's worth paying close attention to your heart health. What affects the heart? Any advice from doctors regarding diet and lifestyle is good, but it only addresses the surface level of the problem. It is important to understand how the risk of heart attack is related to underlying biochemical processes. Key among them are the processes of fat metabolism and protein digestion. The first ensures normal cholesterol levels, and thus protects blood vessels from the accumulation of plaques in them. The second is responsible for the health of the heart muscle. Without normal intake and absorption of quality protein in the body, cells cannot fully renew, and muscle tissue grow and maintain tone. This also applies to heart muscle. The body needs niacin for both processes. This substance is also called vitamin B3 or nicotinic acid. What does it do for the body? In addition to the already mentioned processes of fat and protein processing, niacin provides cellular nutrition, including oxygenation of cells. It helps our bodies absorb vitamins A, E, D, K1 and K2. Niacin is also involved in the maintenance of the nervous system. Niacin directly affects the reduction of triglycerides and cholesterol in the blood, as well as improving the condition of the walls of blood vessels and their clearing of plaques and blood clots. Strengthening the heart muscle, thanks to niacin, entails the ability to pump blood and ensure normal blood flow. This is the key to blood pressure stability, and therefore a lower risk of heart attack. Niacin deficiency leads to pellagra, a condition in which the skin becomes rough. Digestion is also impaired, and the person suffers from frequent bouts of diarrhea. Niacin is involved in the production of sex hormones, so its deficiency leads to reproductive disorders, as well as constant weakness and fatigue. Will it help after a heart attack? Anyone who has had a heart attack knows how difficult it is to recover from such a blow. Fortunately, niacin can help as well. In recent years, scientists from different countries have conducted more than 10 studies involving several thousand people. The results showed that regular intake of niacin leads to faster recovery after a heart attack. This is explained by the already listed properties of this substance for the maintenance of vascular health. How to recognize niacin deficiency? The first group of symptoms are digestive disorders. If you notice sudden changes in stool, from constipation to diarrhea, belching, burning, bad breath and increased saliva secretion, as well as a lack of appetite, it may indicate the need to take niacin. The second indicator is changes in the condition of the skin. Blisters and itching, swelling of the lips, and corners of the mouth can develop. Plaque, red dots and cracks may appear on the tongue. The third area by which a niacin deficiency can be recognized is the nervous system. Feeling of goosebumps on the skin, numbness, weakness and tinnitus, a wobbly gait, headache, dizziness and insomnia. The list of symptoms is not insignificant, but when there is a large deficit, it affects mental health as well. Sudden bouts of anxiety, apathy, and lackluster behavior also indicate a lack of this vitamin. How do you get your niacin ration? The source of niacin is the amino acid tryptophan, which is part of proteins. Therefore, fish, meat and legumes have the most of this substance. It is also rich in eggs, cottage cheese, unrefined rice and yeast. But sometimes the deficiency of nicotinic acid in the body requires taking niacin in the form of a dietary supplement. The dose is determined by the doctor, but usually it comes down to 1 tablet a day. It is important to observe the intake rate, because a large excess of this substance in the body increases the load on the liver, and can also lead to the development of depressive states.